Hi, dentalunboxing.com subscribers. I'm Dr. Tim Kosinski, your guest evaluator. And today we're going to unbox and clinically evaluate sutures from GoldenDent. Let's see what's in here. So sutures, I do a lot of surgery, and sutures can be very, very expensive. And the GoldenDent sutures are packaged like this. Here we have a 3.0 PGA polyglycolic acid or Villet suture. This is a resorbable suture that's kind of long lasting. This is my go-to suture, but they are expensive. Here we have a 3/8 needle. You can also get a 1/2 needle. You can get a size 3.0 or 4.0 or whatever you decide you want to use. 12 sutures in a box. It's going to save you probably half the cost of most of the companies out there. So I'm really looking forward to evaluating clinically over the next few weeks with our patients this suture to see if they hold up to all the other Villet sutures out there, the PGA sutures out there. My suturing technique is very specific, and I want to go a little bit slow here, and then we can speed up a little bit later. One of the biggest problems that I see practitioners in my courses as they're suturing is we have a tendency to go from the facial to the palatal or facial to the lingual. And that creates a real big problem, especially if you have a membrane in position. If you go from facial to palatal, in this case, oftentimes you will engage the membrane or the graft material. And you can suture it tight, but unfortunately, on suture removal, if you are going to remove the sutures in a period of time, you will oftentimes remove the membrane or the graft material or the staph will, and this creates a real problem. We must protect that graft material and membrane for at least a 6-week period. So suturing of the graft or the membrane is imperative. And so if you use a reverse cutting needle, and we're going to discuss that in just a few moments, the design of our dental surgical needles, it is only cutting on one side, and I have taken the needle and I am penetrating from the crestal aspect, from the central groove area to the facial. What this means is I'm riding on top of the graft material or on top of the membrane. I'm not going to engage the graft. I'm going to turn the needle around, and I'm doing the same thing on the palatal in this situation. I'm going from the crestal aspect and I'm engaging the palatal soft tissue or attached gingiva from the crest to the palate area, riding over the top of the graft material in this situation or any membrane. This can't be any simpler than this. We're just doing 2 interrupted sutures in an X form. And this is plenty to hold that graft material or hold that membrane into position. Epithelium will grow about 0.5 millimeter a day. So let's say we have 10 millimeters of exposed area there. So theoretically, in about 20 days, that will cover over completely, assuming that the epithelium is growing about 0.5 millimeter a day. Epithelium will ride on top of this. It will not invaginate into the graft material. I will bring this patient back in a week. I'd like to see my surgical patients back in a week, at most 10 days, to remove the sutures. And the reason I do that is oftentimes the sutures will be a little bit irritative to the patient, meaning we'll do the surgery, they're doing really well. Patients do extremely well. They take Advil. They will do very well for 3 or 4 days. If you don't tell them ahead of time, they may call and they'll say, you know what, tell doctor I was doing really well, but you know what, it's been 4 days, 5 days, and something's wrong, something's bothering me. And it's because the tissue wants to heal, it wants to cover over or close, and the sutures won't let it. So be aware of that. I like to see my surgical patients. We're being paid well for this procedure, and I like to see the patients, see how they're healing, seeing how they're maintaining the area. Hi, dentalunboxing.com subscribers. It's Dr. Tim Kosinski again, one of the guest evaluators from GoldenDent, and I've completed my clinical evaluation of the sutures from GoldenDent, and I want to go through some of the comments that I've made. Number one, did the product save me time? Well, suturing is suturing. I think the most valuable asset of the product is the savings. It is the same exact quality of PGA, polyglycolic acid suture in the violet color, the purple color that I like to use of other companies, but probably at half the cost or considerable savings depending on where you purchase your sutures from. This is very, very important because I, as an implant surgeon, use a lot of sutures in the course of the day. And any savings that I can make is either profit for me or savings to the patient. The material seems to be identical. The needle size, the needle quality, the ability to tie knots with the material, and the longevity of the product is identical to everything that I've used on the market. So I would definitely advise that you look into the GoldenDent PGA sutures. Very high quality, very reasonably priced compared to other sutures on the market today. I give the Golden Sutures, our dentalunboxing.com, our Golden Tooth Award, and would highly recommend that you evaluate this product, purchase it, evaluate it, and I think you'll be very pleased based on my review and my clinical experience. So thanks for watching today, and hit the subscribe button to get notification of future videos that we'll do on upcoming products. Have a good day.